Good afternoon. I am so happy to convene the Health and Human Services Finance Division. And we are here to have an overview, an informational overview, since we are we're in special session, but we're here to have an informational overview of what will be the Health and Human Services Omnibus Bill. And since we are in special session, this is not actually, it would be a conference report, but it isn't, because this is just in special session been reintroduced, or will be reintroduced just as a bill. And but the House and Senate have the same version, and we are here today to explain what's in the bill and give members an opportunity to ask questions about it, to go through the spreadsheet, and for members of the public also to get a really good view of what's in the bill. So we're going to start today. We're fortunate to have DHS Commissioner Lourey and MDH Commissioner Malcolm here. So we're going to start with Commissioner Lourey, and instead of starting by walking through the spreadsheet, which can be pretty long, and we're going to start with an overview from Commissioner Lourey. I do want to say that our bill has shrunk a bit from when it left this committee. It is now 649 pages. I don't know if any members have weighed the bill, but I suspect that it has lost a bit of weight. Maybe members will do that by the time we get to the floor. I don't know. Actually, the appropriations article isn't in there yet, so it may grow a bit. And it has fewer articles in it. And part of the reason for that is that in this bill, we had the elder care portion of the bill that was Representative Schultz's bill that passed separately off the floor. Also the pharmacy benefit manager part of the bill that went separately as well. So those came out. And it's a great bill that we're very proud of. And I'm going to turn it over to Commissioner Lourey to talk a little bit about his aspects of this bill. Commissioner, welcome.
Thank you, Madam Chair and members. And again, my name is Tony Lourey. I'm the Commissioner of the Department of Human Services. And I am especially grateful to be here to talk about this work product and this bill. I do need to start by offering a sincere and heartfelt thanks to all of the staff who put in a level of effort that is unparalleled in my entire legislative experience. I haven't ever been through something quite as intense as this, and I've been through a lot. People, stayed engaged and worked toward a consensus that we could come together and have a bill that I think is going to withstand the test of time and is going to move Minnesota forward and reflects the Minnesota values that we were all trying to accomplish. And we couldn't have done it without staff. And I know everybody, I don't know that there was another bill where the two bodies, the House and the Senate, were further apart than this bill. And so it's a real testament. And, there was no sleep, tempers, and, everything was strained. But we did keep focused on trying to, again, deliver for the people of Minnesota. And I know right now there's many staff that put in just tireless hours that are crashed and on different couches and things around the region, and whether they're here to hear it or not, this is a testament to their work, and I appreciate it a great deal. The core of the compromise really is resizing and the provider tax and being able to invest in some of the things that mean a lot to all of us. And that's what you'll see in here. I'll kind of just talk in broad terms and try to be brief around several of the buckets of service that are represented in here. In the behavioral health sphere, one of the signature items really has to be the CCBHCs, the Certified Community Behavioral Health Clinics. I know we've talked about those a great deal. We got the full package in here to support and make the 6 existing CCBHCs able to sustain and also bring another 5 online within the budget horizon. really a transformative way to serve people with chemical dependency and mental health challenges. And then also we made a significant new investment in school-linked mental health that I know is a bipartisan priority for all of us. Mobile crisis services, new investments in this really underfunded and tried and tested evidence-based approach, plus the full investment in making sure that we can maintain and even improve our children's intensive residential treatment package. These are critical investments in the behavioral health space. Program integrity, I know, was a big piece for all of us. Much needed investments that will improve our efforts to better identify and investigate fraud in our state's child care assistance program to ensure that the dollars we invest go to support the families and the providers in need of the child care that this program is intended to serve. Disability services, we were able to reduce the spend down for Medicaid for people with disabilities as well as parents with disabled children on TEFRA. The changes to our home and community-based services programs will simplify and streamline the administration of these waivers for people with disabilities. And we made significant investments in restructuring of how our disability waiver related service providers will calculate rates and be able to maintain workforce challenges over time. In the children and family services area, we were able to fund initiative tribe status, which is helping counties and tribes serve the Indian Child Welfare Act clients in child protection services across the state. And we had, this one, I got to pause and just really emphasize. In this bill is the first across the board increase in MFIP and diversionary work program in over 33 years. We got $100 a month to every MFIP and DWP family in the state of Minnesota. And that's a big deal. That's a really big deal. That is. And every one of us can now ask for every single picture from 1986 that is out there to be returned to us and never to be seen again. But also the Child Welfare Training Academy is to really be applauded. And I know Representative Moran had some really important pieces that she inserted in there to help make sure that our child protection crews are going out with the cultural sensitivities that they need to approach this life-changing process in a way that is more responsive to the needs of our families. And in that same vein, we have the compliance and the building blocks to implement the Families First Family Preservation Act, which is our first opportunity to have the federal government as a partner in funding upstream investments to help keep families together in the child protection system rather than only funding it once we've already torn families apart and removed children. So really incredible investments. This bill is going to withstand the test of time. We're going to be proud of having passed this bill. A couple of pieces on the provider side that I would like to call out as well. We have a new payment methodology for our federally qualified health centers, our safety net providers, that is going to allow them to better serve the populations that come to them. For our hospitals, we have both hospital rebasing, which was a small item in here, but a really important one that we needed to work hard to make sure survived, as well as the outpatient drug rule compliance with the additional money to soften the blow to some of the safety net providers and 340B providers who otherwise would have been harmed in this. So thanks to staff, thanks to all of the members who participated in this incredible marathon putting this bill together. And I just am incredibly proud of this work product and urge all members, Democrat and Republican, to support this bill and move it forward and get this to the governor's desk and stand for questions.
All right, maybe since Commissioner Malcolm is here, Commissioner Lourey, if you can stay around for a little while, why don't we have her come up and add her part to it, and then maybe we can have questions from members addressed to either of you. You could stay there. That's if she doesn't mind. I'll let her. Let her decide. Yeah, welcome, Commissioner.
Good evening, Madam Chair and members. Jan Malcolm, Commissioner of the Health Department, and I love having this guy by my side. He's a fantastic partner, and this was quite an incredible process. I think we had an incredibly challenging target, and I know that there is a lot of disappointment at what we weren't able to do. But I think with the hard work of the conferees from the House and the Senate, the tenacity that you showed, Madam Chair, and all your conference committee and then working group colleagues, and just the incredibly hard work of our staffs, the Departments of Health and Human Services and the legislative staff. I'm amazed at what we were able to accomplish with a bill of this, not only length and complexity, but the importance of the issues and the importance of what everybody cares so much about. So I too want to add my real thanks to the staff and to the members for your hard work. From a health department perspective, it feels like we've been doing this for a year. I know it's only been a few months, but I appreciated the time that you gave to us in the health department in this committee to talk about kind of the big picture of health in Minnesota and where we could go to make a bigger difference on improving health of Minnesotans and on closing some of the gaps in health status that have faced many in our community for far too long. And I appreciated all the time you gave to that and the evidence that I see in this final product of, while it's still, I think, just a start, the fact that there are prevention investments in this bill is much appreciated. It was a tough target, and the fact that you made room for some prevention strategies is deeply appreciated. I do want to, before going on to what is in the bill, just comment on the 400 pages or so. Wasn't 400, was it? It was, I think the final Vulnerable Adults Act was about 160 pages. But I want to thank the committee for the time you spent on that issue as well, and Representative Schultz for carrying that this year. And that's a big deal to have made that step forward, and I'm grateful for the legislative support. The strong vote at the end of that long process was great. It was really much appreciated, and I think it's going to help consumers in our state and providers feel good and confident about the balance that we've struck and the direction we're going there. So back to this bill, some of those core prevention investments, we shouldn't underestimate the importance and the significance of having continued to fund the statewide tobacco cessation quit line. For as much progress as we've made, that does remain still the largest single threat to health and premature death in our state is tobacco use. And we are seeing an uptick again among our youth, thanks to the advent of e-cigarettes. So what you did with the Clean Indoor Air Act, what you did in funding the cessation, the quit line, is really very important and very appreciated. Commissioner Lourey talked about kind of the central importance of maintaining the solvency and the strength of the Healthcare Access Fund, and that is absolutely so true for the health department, for our statewide health improvement program, and for the analytic work that we do and the direct support that we give to the healthcare system to improve and to be strong. So that was a very big thing. With respect to other critical prevention strategies, I'm really grateful for the support for a more robust suicide prevention package that wouldn't have been there but for the House's strong position on a comprehensive approach. It's wonderful to be funding again and rebuilding a statewide suicide prevention lifeline, but that's not enough to turn the curve on this epidemic. So I really appreciate the House support on strategies that work with healthcare systems, but also with communities to try to get upstream and try to understand what are the risk factors and prevent and appropriate culturally specific prevention strategies. The recognition and keeping in the budget, even when the dollars were very tough, some of those very targeted efforts to respond to the needs that are coming directly from communities facing some of the biggest health inequities in our state, is important. The Community Solutions Fund, though it is modestly funded, we have a chance now for the next 4 years to really listen to what communities have been saying, that they need to have a voice at the table to develop the solutions that are going to work for their communities. And I greatly appreciate your support for the Community Solutions Fund. Funding for domestic violence is also a critical strategy to improve the health of families and communities, and that was a strong House position. Funding for an emerging issue that we now understand much more about the significance of, the skin lightening education about the dangers of skin lightening cream, which threaten the health of children and families and communities. And then you made some really important core infrastructure investments in the health department's capacity, and we really greatly appreciate it. To have finally helped us raise the safe drinking water fee for the first time since 2005 is a really big deal to protect the quality of drinking water and to avoid shifting that burden to local governments or to small private businesses who run public water supply systems. And that's really very much appreciated. Your recognition, really for the first time, that we need to figure out a way to get some state funding into the maintenance and continued replacement of laboratory equipment to keep our public health lab at the very forefront of public health in this nation, and that was much appreciated. Your recognition that when we have big responsibilities, we need to have the funding to deliver on them is really appreciated. I thought we had a good discussion in both bodies, both in the House and the Senate, on the medical cannabis program and how it's grown and how it perhaps could evolve in the future. Your support for giving us the operations funding that we need to keep pace with the program that has grown far bigger and far faster than I think we might have expected 5 years ago when the program was established. So just, those aren't the sexy things, those kind of operating increases and pieces of infrastructure, but they matter so much to our capacity to stay vigilant and to stay on top of threats to the health of our people. So I just really appreciate that. I'm personally looking forward to the Blue Ribbon Commission that was a part of the bargain that our top leadership set to give us a target for how to find a significant amount of savings in public programs through really engaging and thinking big about how to bend the cost curve in sustainable ways. So I look forward to partnering with Commissioner Lourey and with many of you and with our smart minds in the community about how we can do that. So I thank you for the hours that you gave to talking with us about these issues and to a product which I agree with Commissioner Lourey. While far from all that we would have hoped, we did the absolute best we could with what we had, and I think we will reap some very good benefits for the state from these investments. Thank you.
All right. Well, thank you, Commissioner. Thank you, both of you. So I think that we are going to walk through the spreadsheet. So they've touched on certain things that are in the bill that are important to them. And of course, there are many more, and there's a lot to talk about. And we can talk about also what came out of the bill and so on. But I would just want to pause here in case members have questions about anything so far. Did anybody want to ask any questions? Okay, not seeing any. Oh, yes, I am. Now I'm seeing some. Right. Representative Loeffler.
Well, thank you, Madam Chair, and I haven't found the language in the bill we just got, but we just have heard snippets in the press about this Blue Ribbon Group and the $100 million it's to save, and it wasn't clear to me if that is just in healthcare, it's in any services within this budget. If you could just clarify what the focus is, that would be helpful.
Commissioner Lourey.
Madam Chair, Representative Loeffler, it is not just healthcare. It is health and human services wide. It's taking a look at ways where we can streamline, find greater efficiencies, do a better job. We're going to try to pull people together and see if we can, evaluate the partnerships that we have in delivering care. The state-county partnership. How do we approach it? What are lessons we can learn from other states, from private sector partners? Try to see if we can take a holistic view of where we're at and see if there's ways where we can do a better job. So it'll be a heavy lift getting in and trying to take a look at this, but it's certainly broader than healthcare. It's health and human services wide.
Thank you.
Okay, Representative Halverson and then Zerwas.
Thank you, Madam Chair. I didn't have a question. I did just want to thank the commissioners for their hard work and dedication to this process, and thank the staff as well that was there at all hours of the day and night to make sure that we had questions answered, we had the technical support that we needed to continue our work, and really appreciate your dedication to the health of the people of Minnesota. So I just wanted to say that, and I think we're going to say that a few times today because it was a Herculean task that everybody took on, and we're very grateful.
Right, thank you, Representative Halverson. Yeah, it's hard to overstate in this case how hard people have worked to pull this together in just an amazingly brief period of time. It is really quite astonishing. Representative Zerwas.
Thank you, Madam Chair. And I also want to touch on the Blue Ribbon Commission as well. That's something I think that was generated out of leadership court, which is like the people's court, only this one wasn't on TV. It looks like from the spreadsheet, we're going to pay, are we paying $500,000 to recover how much then in the tails? Or could one of the commissioners walk me through how this is going to work, and if these savings are backed up in case they are materialized, and how that works?
Yeah.
I remember a budget process, Madam Chair, in which a different majority looked for ways to limit waste, fraud, and abuse and extract savings from a budget that the chair was probably less interested in than perhaps this time. And so I would love some information on how this is going to be operationalized.
Yeah. Well, Representative Zerwas, I think I'm going to ask maybe Mr. Burke to talk about that in a minute, but I would just say that remember that this bill is really the work of a lot of people, and the budget, as you know, was set by the governor, the speaker, and the Senate Majority Leader, and they put together, so there's certain elements that came from that, and this blue ribbon idea and the $100 million savings from it came from them. So there were certain things that came to us with our budget target. So from the fact that that's in this bill, do not infer that I love that or that I think, don't infer anything about how I might feel about it, because those were the marching orders. Same thing with the target, which I viewed as completely inadequate for what we needed to do. And in fact, some very, very important things dropped out of the budget because we just could not afford them. So, in spite of the fact that a lot of savings were found, it was extremely challenging. So that $100 million that's part of the budget that is going to be found by this blue ribbon panel, that came to us as part of the budget, and other parameters as well. So, you just deal with what you got. So, but if you want to do that right now, I would ask Mr. Burke to just explain that part, if you would, not right now going through the whole spreadsheet, but just that piece that comes from that blue ribbon thing.
Madam Chair, Representative Zerwas, it's relatively straightforward. The spreadsheet books $100 million in savings in the next biennium, in the 22-23 biennium. That is, as you alluded to, backed up. Since we're taking actual savings off the books, there has to either be savings produced by the Blue Ribbon Commission, or there has to be a way to cover that, so that is backed up by a transfer from the budget reserve if necessary, in an amount up, if there is an amount less than $100 million. Because we have to have real money on the sheet to actually book $100 million, and the Blue Ribbon Commission will be charged with finding that money. But there is a backstop to make sure that actually works in the budget.
Representative Zerwas.
Well, thank you, Mr. Chair, and thank you, Mr. Berg. That answers kind of my first question about that. So then a question for the commissioners, since this is the apparently perhaps at least the three leaders that negotiated the budget targets. This is from them. Is this something that the governor believes can be found? Does he have faith that there is $50 million a year within those 2 years, within the next biennium, that money's being expended currently that doesn't need to be expended? And if so, what main areas will you expect the Blue Ribbon Commission to focus on to identify this unnecessary spending?
I see everybody's jumping to answer the question. Commissioner Lourey.
Madam Chair, I'm not going to jump and presuppose exactly where we're going to look for it. I am hopeful that we will be able to work together. I mean, I think it calls for a good stakeholder process where we can have a good, thoughtful engagement over the interim and take a deep dive and hopefully come up with some really good ideas. And trying to presuppose the work of a body that's much broader than myself would be premature, I think. And so I don't want to try to artificially get ahead of that and scope it, but I don't think it's an unreasonable expectation that we succeed.
Representative Zerwas.
Well, I would just say that I agree with the commissioner. I think you probably can find $50 million in waste, fraud, and abuse. And I'm excited that the commissioner and the governor believe that that wasteful spending is out there to be found. And I wish the Blue Ribbon Commission luck. I don't know if nonpartisan maybe could help me on a page and line number for the Blue Ribbon Commission. I've had the bill in my hands for about 7 minutes now, so I'm just wondering if we can find that and go over the makeup of the Blue Ribbon Commission.
Mr. Chun.
Madam Chair, Representative Zerwas, the Blue Ribbon Commission begins on page 444, line 14, and then the membership of the commission is specified beginning on page 444, line 19.
And Madam Chair.
And Commissioner Lourey.
One thing, I guess, in response to, I would say, it's not necessarily fraud, waste, or abuse. I mean, oftentimes we can save money by better serving the clients that we serve in ways that are more efficient. But that doesn't necessarily mean that the savings is generated by fraud. That's not fraud. It's not waste. I mean, the services right now, I mean, if we need better care coordination for individuals with particular needs, and we can provide that care coordination, and it reduces the higher end services, the higher acuity services. If we can approach mental health by investments upstream, we can save downstream more acute exposure to budgetary pressures. That's not necessarily waste that is happening, and it's certainly not abuse either. It's just we can find ways to be more efficient, to learn how to do our work better. And one thing that I also need to add is that this task force, this Blue Ribbon panel, is going to come up with ideas that are presented to the legislature. The legislature has to pass those ideas in a bill in order to prevent the transfer. I mean, if the legislature doesn't like the ideas for one reason or the other, that's also beyond the purview of this Blue Ribbon panel. So there will be some recommendations, presumably, and we'll find a way to bring them before the legislature, and that's the makeup of this.
Okay, I have Cantrell, Schultz, and then I know Zerwas. Representative Zerwas, go ahead.
I just have one last final question. It's on line 446.1 as one of the duties of the Blue Ribbon Commission, number 3. Is look for opportunities for reducing fraud and improving program integrity in the HHS services, and then it continues on statewide strategies for improving access. And so I'm certainly supportive of the Blue Ribbon Commission. I'm excited to work with you. I saw the makeup has 2 members of the House, and I'd love to help out any way I can, Madam Chair.
All right, so noted, Representative Zerwas. I'm not sure who's doing the appointments. I haven't, probably the governor, I assume. I don't know.
not the legislative ones, Madam Chair.
Oh, all right, good, okay. Well, all right, well, we'll take that under advisement for whoever's going to do that appointing. Representative Cantrell.
Thank you, Madam Chair. And first, thank you to all the staff and all the conferees and to our commissioners who worked so hard to put this bill together and to negotiate, I think, a really solid HHS bill. So I just had one really brief question. I carried a bill for the appropriation or renewed appropriation for the Palliative Care Advisory Council, and it looks like that has not been included in the final version of the HHS bill. So I was just personally curious as to what will the fate of that council be? What does kind of its funding mechanism look like moving forward? Probably for Commissioner Malcolm, Madam Chair.
Commissioner Malcolm.
Madam Chair, Representative Cantrell, it's a great question, and I just asked the same thing myself about half an hour ago. So I think the commission or the advisory committee remains in statute. So we'll be looking at, well, what does that mean? How can we continue to get the benefit of that advisory council being in place, and how will we approach it? I don't have a great answer for you at this moment, but certainly the topic is important, and we have valued the discussions that group has had. So we'll get back to you with a little better answer.
Thank you, Madam Chair.
Representative Cantrell.
Thank you, Commissioner. That's all I have.
All right, Representative Schultz.
Thank you, Madam Chair. And going back to trying to save $50 to $100 million through this Blue Ribbon Commission, you know, I'm a little disappointed that we weren't able to retain the dental and the pharmaceutical purchasing a proposal that Governor Walz had put forward and that was carried in the HHS House Omnibus bill, because I think those proposals would definitely bend the cost curve and reduce our spending in those areas. So I'm looking forward to seeing the recommendations from this Blue Ribbon Task Force to see if those are worthy of revisiting in other areas that we can reduce administrative costs, increase efficiencies, and reduce the growth rate. Because I think it's necessary that we start finding big ideas and getting bipartisan support through this task force to do that. So Representative Zerwas, I hope you can join us in looking at not just waste, fraud, and abuse, but reduce efficiencies, reducing cost growth, and seriously looking at those proposals that Governor Walz has put forward as well.
Thank you, Representative Schultz. And, okay, other questions? Oh, okay, Representative Moran.
Thank you, Madam Chair. I, too, like so many others, first just want to thank our staff, right, for the long hours that they invested in just putting this work together. It is unprecedented to see people work that hard. I just want to thank the commissioners up there for their support and input. And there was days when, things were tough and complicated. And for me, bringing the equity pieces to the forefront. And so I just want to share just how important I think that is. We have talked a lot in this body about waste. And I'm just going to say that, here in the state of Minnesota, we have some of the worst disparities in the country. And we're spending a lot of money. And in my mind, we're not getting the outcomes that we need for communities of color. And so really having a place where we are listening to communities of color around solutions to improve the outcomes of communities of color, I think is critically important and something that we should not negate, nothing that we should look over or bypass, and something that I truly believe that we really need to be doing more investment in. I am one who believes that those who are impacted by systems can really bring solutions to the table about how to improve those systems. And they should be in part of the planning, the implementation, the evaluation of program services and systems. It's really, really important that we look to these communities as solution builders and not just groups that are a part of disparities. We do, and they do have answers. And so the investments that we made in the community solution grants is critically important to see better outcomes. And to be clear, we all need to know that when we have such huge disparities, one-time funding is never, ever the solutions. Research and data tells us if we want to see an impact in different outcomes, we have to do some investment of at least 5 years. And so we have a long way to go to believe that, to know that, and begin to invest in it and make that a priority in everything that we do in the state of Minnesota until we see different outcomes from these communities. And so the community solution grants was, I thank you for the funding for that, the domestic violence and sexual assault prevention, the skin lightening cream, looking at peer-to-peer parents was really important, that parents who've been impacted by out-of-home placement, who are now in a position to help parents who are in those situations navigate a system that they do not trust, a system that they do not believe in, and a system that has failed them and have taken their kids out of their homes. So it's really good to have those who've been impacted by that system helping other parents to navigate that system so that reunification can happen for those children and families. I am elated that we have invested in the child care assistance program. That is a program that serves over 30,000 kids and impacts 15,000 parents. We know the importance of the first 5 years of life to improve better outcomes for kids, and to do anything else but to take that away from these kids that we, from the lowest income, the most vulnerable kids in this state, was cruel. And quite frankly, I think it traumatized a lot of folks, including me, to even think that the state was going to do that. And so I'm really happy that we was able to leave that stable as it is. We failed to fully fund it by eliminating the basic sliding fee wait list, something else that we have to work on to ensure that we're doing the best by our youngest individual, our youngest children, our youngest baby in the state, so that we have better outcomes. So we have a lot of work to do. And the funding, the base funding for Health and Human Service, unfortunately, didn't allow us to do the work that we need to do. And so my hope is that we continue to do better. We continue to do some upstream investment in prevention. I am elated that we're working on the Family First legislation that's coming down from the federal government. We need to look at prevention. We need to invest in prevention because we're spending way too much money on the back end. And we can stop some of this stuff, or we can just begin to invest up front. So I guess I better stop there. But I want to just tip my hat to Chair Liebling. It's a big committee with a lot of moving parts. And to all the Health and Human Service Committee members, just my hat's is off to us all. Jen, hard work, Lourey, who left out, but we all did a great job with what we had in front of us, and so I just want to say thank you.
Thank you, Representative Moran. I think at this point, unless anyone, I don't see other member questions, I think I'm going to ask Mr. Berg to walk through, because there's so much in this bill. And of course, the spreadsheet doesn't say it all, by the way, because, so I think all the members do have a list that House Research put together of all of the items in the bill as well. And as you can imagine, I mean, it's still quite a large bill with a lot of items in it, and even walking through the spreadsheet takes a great deal of time. So, because we know, because we've been through it so many times. Mr. Berg probably dreams about going through spreadsheets. But, so I'm going to just ask him to walk us through it in kind of briefly, because members can also, of course, read it, but I've always found it helpful to get a little orientation to the spreadsheet and understand kind of what the major money is doing in there. So, Mr. Berg.
Madam Chair, yes, I'll try to move pretty quickly through this. Just to orient members, you should have a spreadsheet in front of you labeled Health and Human Services Budget on top. In the lower right corner, it should say 5/24/2019 at 2:49 p.m. And the right-hand 6 columns that are labeled at the top, special session revisor number 195223, reflect the bill, the agreement and the bill that will be in front of you. It is compared with the biennial columns for the House, Senate, and Governor from the regular session. And just some summary information at the beginning. The committee had a target of negative $357.8 million in the general fund in 2021 and negative $557.2 million in the tails. And
Okay.
okay. If you look on line 3, which is a little smaller than normal there, because there's a quirk in this bill, there's a small open appropriation, so I have to show it somewhat differently. But if you look on the 2021, this bill has a net general fund impact of negative $358.233 million. That is actually below the target by $384,000. And a net general fund impact in the tails of $562.6 million, which is actually $5.4 million below the target. I'll note just on line 8, the Healthcare Access Fund, it has net spending in the bill of $478 million in 2021 and $671 million in the tails. That's the result of some fairly large financing items that make the whole picture work. And if you go to compare it with the prior columns of the House and the Governor, you'll notice there's a very substantial swing from credits to the Healthcare Access Fund to spending. Importantly, the House and Governor's bills originally carried the provider tax revenue in the Healthcare Human Services bill. That revenue is now in the tax bill. However, if you go from line 17 to line 25, there is a tracker for the Healthcare Access Fund, which is pretty accurate at this point. And you'll see that the Healthcare Access Fund should have on line 24 balances at the end of fiscal 23 of about $228 million. Just moving down to lines 27 through 31 is a similar tracker for the TANF funds. And I'll just note that the balance at the end of 23 is 0 in the TANF fund. And we'll come to the main TANF item in a bit. I'm going to jump over the next full page is summaries by fund by department. And so if you're interested in a particular department's particular funds, that's where you'll find it. But I'll move to page 3, where the actual initiatives start for the Human Services Department. On moving quite quickly, line 118, there's just a savings item at the Department of Human Services of $2 million biennium. This is an artifact of the Vulnerable Adults Bill. It was part of that package, but since there's we couldn't reduce a base that was not there, it had to show up in this bill. On page 4, we have on line 138 the Senate's item for funding the nursing facility moratorium construction exception project process. That also is combined with an item the House carried, Representative Cleavehore's bill to encourage energy savings projects in nursing facilities. And now the item in front of you attempts to do both of those and fund, in addition to other projects, fund energy saving projects with the moratorium exception process. On line 142 is the Border City Nursing Facilities item that the House carried. I think, Madam Chair, I'll just move through the items and not
Sure.
go with each, I mean, your choice. but
Well, I think we should move quickly,
Okay,
and then
so I
if
won't give
members,
each dollar
raise your hands, please, if you want to pause on any item, but I think we
right.
can go quickly through these.
Madam Chair, moving on to line 154, this is the Child Care Assistance Program federal compliance, the regulatory part of it, not the rates part. You'll notice a big difference from prior iterations. This uses primarily federal funds to do the regulatory costs. Moving on to page 5 at the bottom on line 186, the conference or the working group chose to take the underspending in fiscal 2020 and the basic sliding fee and to sweep that balance to help the funding overall work. At the on line 190 is the Child Welfare Training Academy item. This is a governor's item, and the House also carried it and is in the final result. On the top of page 6 on line 196 is the governor and the House's tribal child welfare initiative expansion that the commissioner mentioned, funded at the full amount. Line 208 is one of many program integrity items in this bill. This is the Child Care Assistance Program integrity item that the governor proposed and which the House and partially the Senate also carried. On line 213 is a Senate item that creates a family child care task force. The Senate brought that in, and actually the department had an idea to actually beef up the task force a little bit, and that is there. On line 229 is the governor's item for Family First Prevention Services Act implementation. This is a federal compliance issue, and the House and the governor carried this item, and it's in at the full amount. Moving on to page 7 on line 240. This is the MFIP cash grant program. This is where the excess TANF fund, well, not excess, the TANF funds are spent. If members are aware, the tax bill refinances the working family credits so that TANF funding is no longer used for that purpose. And it is now back in the Human Services Committee where it's used for most of the cost of a $100 increase. If you look at it, you'll see there is some general fund cost to bring it up to the $100, but it is primarily TANF funding that's paying for the $100. Moving to page 8, line 274, this is another integrity piece, the CCAP provider registration and oversight item. The governor carried this item, and the House did as well.
And Mr. Berg, just, Ms. Niederhofer reminded me, all of you should have a ruler like this. I don't know if some of you just don't like to use it, but I find them really helpful if you want to follow along with it. Anyway, please continue.
Right. Madam Chair, on line 279 is the first of a series of items. You'll see where there are hashtags in there. What the hashtags indicate is that this is an item that's been done in the bill, which is done without a cost. And so the first one is the modernization of the telephone equipment distribution program that had been in the governor's budget. Line 283, this is an item related to TEFRA. It is developing educational materials to help people understand and navigate the enrollment process for TEFRA. Moving to page 9, line 324 is another of our hashtag items. This is changing step therapy override criteria, but it's doing it in a way that does not incur a state cost. Line 328 is the Parent Support for Better Outcomes grant program. That was a House provision. On line 332 is additional funding for the Safe Harbor for Sexually Exploited Youth program. This exists at both departments. This is the DHS piece. We'll come to a piece at the Health Department in a bit. On page 10, line 347, this is the reduction in TEFRA fees. The House had a 15% reduction. The Senate carried a greater reduction. The conferees went with the 15% reduction in fees. On line 356 is the reduction to the MA disabled excess income standard. The numbers represented there bring the income standard to 100% of federal poverty level on July 1st of 2022. That is, we are going all the way from 82% to 100% in the last year of the upcoming, the out years. Or put it differently, there won't be a spend down at that point. Line 363 is the departments and the governor's simplify and streamline home and community-based waiver item. It is slightly altered from the original proposal, but it is largely the same. On page 11, on line 378, is the department and the houses and the governor and the houses item for the certified community behavioral health clinics expansion. This is done at the full amount and will add, I believe, 5 clinics to the 6 that exist. In line 402 is the elderly waiver rate increase for facilities that have greater than 50% of elderly waiver residents grant item. The Senate had brought this in and ultimately changed it into a grant for those providers who serve greater than 50% elderly waiver residents. On line 411 is a Senate grant item for day training and habilitation providers to transition in the DWRS process. On line 12 is one of the major items of negotiation throughout the Senate, which is the DWRS competitive workforce factor. The governor, the House, and the Senate all had similar but somewhat different ideas. Ultimately, well, Ms. Pinelli could go into more of the detail, but the main fact of this is that it is a workforce factor of 4.7% and is one of the large spending items in this bill. On line 441 is another hashtag item. This is HCBS and DWRS labor market reporting and data analysis. This item is subsumed into the DWRS competitive workforce factor item. All parties agreed that there was a need for more and better workforce data as part of this initiative. And the DWRS initiative had some of that, and the Senate had a separate item for it, and they are blended together in the DWRS competitive workforce factor item. On page 13, on line 465, is the governor's children's intensive service reform package. The House also carried this. There is only, while the numbers look slightly different from the prior ones, the only difference is actually the 2-month extension of the current children's IMD funding, which was part of the original numbers but was funded in a separate bill. So it lowered the cost slightly in the first biennium. Moving to page 14, on line 495 is the department's reform of behavioral health services initiative. This is both, as implied, a reform of the way behavioral health services are handled. It also creates a savings in the general fund. The difference from the original proposal is some delayed dates on some items in there that created greater savings, but it's essentially the same initiative. On line 516 is an item that all parties carried, the governor's budget and the House and the Senate, which is the increasing timely access to substance use disorder treatment. On the very last line on that page, on line 521, is an increase in funding for fetal alcohol spectrum disorder grants. That is permanent funding added to the existing base for fetal alcohol syndrome grants. On page 15, line 530 is an expansion of the School Link Mental Health Grants program. There's a modest expansion in the 2021 biennium, and then an additional $4.5 million a year in grants in the tails. On line 540 is the Senate's, a part of the Senate's Community-Based Children's Mental Health Grant Program. It's just a slightly lower grant. On page 16, line 566 is additional funding for the Mobile Crisis Services program. It goes up somewhat in $2.5 million in the next biennium and 9.8 in the tails, and that's for statewide mobile use or availability of mobile crisis services. On line 574 is the Senate's item for specialized mental health community supervision pilot project. This involves law enforcement in a particular county and how they're handling some things. On line page 17, line 590 is the electronic visit verification item. This is again something that's required in federal law and also has a savings in the tails. On line 609 is the governor's item for Greater Minnesota Sign Language interpreting capacity, which all parties carried at some level. The Senate had delayed the start of it by 1 year, or by one biennium rather. On line 617 is an MA rate increase for doula services that the House carried. On page 18 at the top is the first piece. There are two pieces of the House's items for MA coverage. This is the MA coverage portion of pediatric autoimmune neuropsychiatric disorders, which is generally known as PANDAS. And there will come to another part of this at the end of the sheet at the Commerce Department. Line 634 is a hashtag item that I referred to before. This is the energy assessments item. This is now part of the moratorium exception process. On line 638 is the governor's proposal for updates of the HIV statute language. On page 19, line 665 is just a technical item that refinances a particular mental health grant out of the Healthcare Access Fund and into the general fund. It has no net cost for either fund. It's just aligning where the payment is occurring. On line 685 is the self-directed worker union contract, the cost of that contract. On page 20, line 708 is another hashtag item on Community First Services and supports eligibility for pregnant women, which does not carry a cost for the policy. On line 725 is the governor's substance use disorder waiver item, which has got, again, another item to reform the way services are provided, but also a savings, substantial savings that's going to be part of that initiative. On page 21, on line 737 is additional funding for the Minnesota Sex Offender Program. On line 743 is additional funding for the Minnesota State Operated Services, an operating adjustment. Line 747 is another hashtag item where a repeal of some outdated rider language that has been implemented, and there is no cost to the repeal of that language. On line 751 is a plan to increase bed capacity in direct care and treatment health services programs. This also, if you look on the second line of it, creates a general fund savings. At the bottom of the page on line 768 is the Direct Care and Treatment Competency Restoration Task Force, which is a department initiative to look at that whole idea of competency restoration and how it's handled. On page 22, line 774, this is one of the items that's sort of in the big picture of how the financing of this bill works, and in the big agreement, this was one of the items. This is refinancing $270 million a year biennium of medical assistance costs from the general fund to the healthcare access fund. On line 786 is Representative Zerwas's item for agency hearings for county disputes of charges for delayed discharge from DCT facilities. Line 790 is the federal compliance with the outpatient pharmacy rule. This is funded at the full proposal. The Senate had a slimmed down proposal that did not provide additional grants to some of the hospitals, but the governor's initiative was what was chosen. Line 799 is the governor's item for modifications to the MAEPD program. On page 23, line 811 is the House's item to provide funding to the Emergency Services Grants Program for emergency shelter. That's a one-time item. On line 822 is the durable medical equipment rate methodology. This is a modified proposal from the governor's initial one, which it pays to the upper payment limit for items that are subject to the upper payment limit. So it doesn't actually cut a provider's rate. It just makes it so that the state does not pay more upfront and have to claw back the money to the upper payment limit.
Representative Zerwas.
Thank you, Madam Chair, and I apologize for jumping in, but I just want to make sure when I saw this posted on the spreadsheet earlier in the day, that's one of the things that I keyed in on. As we've been talking about this before, there's kind of the few categories of DME and the impacts from the 21st Century Cures Act. As I recall, there's a group of, there's kind of a category that has that upper payment limit set. And so this addresses kind of bucket one. And then the governor's original proposal then also had kind of for category 2 and 3, a decrease in the rate there. My understanding, I haven't looked at the language for this part yet, but kind of going off the base of the numbers, am I accurate, Madam Chair, to Mr. Burke? This is just addressing the mandated upper payment limits for federal conformity for 21st Century Cures, and leaves the other portions where they're at? Am I understanding that?
Well, maybe one of our House research people can explain that. Mr. Chun, is that one of yours?
Yeah. So Madam Chair, Representative Zerwas, I think generally that's right. That this is just dealing with the Medicare upper limit for what is paid for the dual eligibles.
Representative Zerwas.
Thank you, Madam Chair. So in the governor's original proposal, he went across the board on some other DME items that didn't have codes and tried to standardize that, and they captured, I think if I remember right in the governor's original proposal, the savings was closer to like $7 million, if I remember that.
Yeah, that's on
Well,
the
that-
spreadsheet right here. Yeah, you can
Oh.
see that the savings are reduced significantly.
Okay, so
Yeah.
so it's just dealing with that first group then, okay. That's helpful, thank you.
Yeah, thank you.
Madam
Mr.
Chair,
Berg.
Representative Zerwas, that's my understanding of it, yes. On line 829 is the repeal of the volume purchasing of incontinence products item. The Senate was strongly interested in this and actually had it in their bill originally without funding and
So I
did
just,
fund it.
I just have to comment that the Senate was so interested in not having to deal with this again that they paid for it, and we let them.
Well, and Madam Chair, just briefly, and I don't want to
Representative Zerwas.
I don't mean to belabor this, Madam Chair, but this came out of a high-stress, late-night negotiation session between the former DHS commissioner, 2 commissioners removed, myself and Chair Dean at the time, and this was a throwaway line at the negotiation table that got put on a spreadsheet with a number pulled out of thin air that for the last 3 years has really, really impacted providers. It quite frankly scared a lot of people. And within the DME space in Minnesota, we've had multiple providers across the state in the last few years that have gone out of business or shut down. We had a provider that after this was put in, a bank called in their loan because of the volume that they did in incontinence products, and within 2 days, their business was closed. It was done. It was over. And so I think as we talk about moving forward in a better way of handling this process, and you know there's several of us that have frustrations and concerns about this process.
Only several of us? Okay.
Maybe a lot of us, Madam Chair. But I think my point being that these have huge impacts that follow us for years.
Point well taken, Representative Zerwas. This entire budget impacts people's very lives, well beyond even closing somebody's business. And you are so right. These decisions that we make here in this committee and on the floor and in conference committees and in the dark of night, sometimes in work groups and however you do these negotiations, it really matters. And I think your point is very well taken. And just to say, members, we're going to go just another 15 minutes. And, Representative Schultz.
Thank you, Madam Chair. So just at that point, I remember that happening because the chair at that time was not able to book true savings. And so I really want to thank Chair Liebling for putting together a realistic budget that didn't book sort of savings that could never materialize. And I'm not criticizing, I'm just saying the process was flawed because at the last minute, they had to find some type of savings to balance that budget that they had at the time. So I'm hoping we don't run into that problem here. And I don't think we will because I think we're trying to use realistic information on where there's savings and where there may not be savings.
Well, at least the monopoly money is backed up by real money. At least we know that, if it turns out to be monopoly money
Well,
in this budget.
and Madam Chair, I mean, I guess shame on us for not thinking of a blue ribbon commission.
Yeah, well,
You know, dang it.
we are.
If only we
are-
thought
we are not,
of a blue ribbon
yeah.
commission, because apparently then you can find $100 million.
Let's criticize it if we don't find it, but let's wait. Let's hold it.
Yeah, anyway, again, I have to say that this committee did not come up with that brilliant idea. And we will all do our best to make sure that it is really brilliant in the end. Okay, we're on line, 833, I think, and we're just going to.
Madam Chair, we'll try to
Oh,
speed it up
and
here.
I'm sorry, Mr. Berg, Representative Hamilton,
Thank
sorry.
you, Madam-
let's
I
see
can
you.
wait to the end, but I would like to make a few comments if I could.
Okay,
I can wait
let's
to the
maybe,
end.
would it be better, it's up to you, we want to make it now or wait?
Madam Chair, I just want to talk again. First of all, you've done an exceptional job. And when we're in conference committee, yourself and Chair Benson, I'm sitting back as in the minority, right? And I was thinking that both of you are doing an exceptional job in conference committee. I also want to give credit to Chair Moran, Chair Halverson, and Chair Schultz. I always felt initially that it was very productive, and that I was included. And I felt very much as if what I had to say was valued. You know, we're going through there, we're adopting the same and similars, we're setting aside the things that we disagreed upon, and I was really intrigued, or I was hopeful that we were going to be able to vote on those things, debate them even more and vote on them. And then the wheels fell off, Madam Chair. We were waiting around for the leaders to make a decision on what the budgets were, and we went days where we weren't meeting, or we only met for an hour. And that was very unfortunate. You know, I had a member come to me today, and they're upset, and rightfully so, very passionate about what we had in our bill that's not in here. And of course, they're looking for answers. Well, was it the House that gave up and threw it out, or was it the Senate? And my response was, I don't know, because I wasn't involved in those conversations. And, you know, this is, I guess my comments are more towards the bigger picture of things. Why do we even have conference committees if we're not going to allow the conference committees enough time to do their work? I really appreciate what we're doing here today. And I said the same thing for Chair Poppy when it was done. I was critical of her ag bill. I'm the lead on agriculture. It came to us too late to even read what was in it. And when Chair Poppy had a meeting like this, we were able to fully vet it. And it was a good bill, and many of us voted for that. It would just be, if we could get to the point as a body to put the pressure back on our leadership and demand that we have these budget targets to us quicker, to where we can actually do the work as conferees in the conference committee. And then if there's another step involved where once that was done, we brought it back to the committee to where we could all fully vet this and understand what's in the bill before going to the House floor. Give us plenty of time and allow people to weigh in on it as well. This is the people's house, and they should have an opportunity here too. So my comments are not critical to you in any way, shape, or form, and I hope you don't take them that way. However, I am very critical of what took place at the end of session, and hopefully that we can do this differently in future years. Thank you, Madam Chair.
Thank you, Representative Hamilton. You know, you saw how I want to do this in the way that conference committee is conducted, and I have to say, if I'd had my way, we would have met all day, every day. And I do have to say that some of our counterparts really preferred to not meet and wanted to do those deals in the back. And you saw me push a lot of those conversations into the public as much as I possibly could, in spite of facing some real pushback from the other side on making them do that. If I had my way and if I had the time, I would have done the whole darn thing that way, because I'm with you. I think that was really productive when we did it. We did about 30% of our bill that way, adopting stuff in public, but we ran out of time, and as you say, the budget targets didn't come to us until very, very late. And, you know, part of that, I also do, though, want to give credit to Speaker Hortman, because she tried. They set an earlier deadline, and she's trying to change the culture around that for the very reason that you're saying. And I firmly believe that you get a better product when you do it in public. It's not only that, you know, the public wants you to do it that way, but that we actually are better when we actually have to sit in public, like we do in this committee all the time, and we talk about what do we like, what don't we like, and you take a vote sometimes. And I wanted to vote and was never able to. You had amendments, I wanted to take a vote, and the other side was quite angry at me for wanting to take votes and push things into the public. So we did the best we could. It's a learning process. I so appreciated your participation, and I really thank you for that. And
Madam
yeah,
Chair,
Representative Hamilton.
And I'll just, for all the other members, I'll vouch for what you just said, because you and I had those conversations where you came up to me directly and said, you know what, I think we just need to vote on this in the public. And so I would just validate everything that you had said there. So thank you once again.
Thank you, Representative Halverson.
Thank you, Madam Chair, and thank you, Representative Hamilton, for your participation on the committee. You're right. You you were part of the team, and to me, the greatest moments up here during the very hard sessions are always the moments where we become Team House, not Team Republican or Team Democrat. We're Team House, and we were Team House.
Yes, we were.
And we had really important conversations in public. And the conversations that didn't get had in public, I don't think we delivered in the same way for the public. And so I am completely on board and want to see this vision come to fruition next year and the year after that and the year after that. This was a good first step with the way that this conference committee operated, and we'll keep that, I think, front and center moving forward.
Yeah, thank you. I'm going to let Mr. Berg try to get through some more of this, but thank you for that conversation. I think that's very important. Mr. Berg.
Madam Chair, members, I'll try to move quickly here. We left off on line 833, which is a governor's item on updating Indian Health Service provider payments. On page 24, at the top on line 841 is a governor's item, and all sides took it on another integrity piece of related to non-emergency medical transport. On line 849 is a Senate item that related to moving people who are absent from the state for more than 30 days to fee-for-service. On line 860 is the Senate's item for a corrective plan to eliminate duplicate personal identification numbers. On line 865 is another integrity piece on improving medical assistance benefit recovery. On page 25, at the top on line 870 is the governor's item on closing gaps in healthcare coverage for children in foster care. Line 889 is another hashtag item. The policy has no direct cost of the state budget for aligning application assistance payments. On page 26 at the bottom on line 932 is sort of another of the large pieces on how the finance in the bill works. This is a reduction in the forecast assumption for the managed care payment trend of 0.8%. And similar to the item with the blue ribbon panel where we're taking actual savings, this is backed up by a contingent backfill from the premium security account so that we can book actual savings. The department needs to try to get those savings from better managed care rates and bringing the cost of that down, but if not, it is backed up by the premium security account. On page 27, at the top is the cost of the rate increase that happens with the repeal of the provider tax sunset. This is the rate bump that happens in public programs because of the provider tax. On line 940.
And Mr. Berg, just to say, if I'm correct, that means that because they have to pay the provider tax, we pay them more to cover it in the public programs. Is that correct?
Correct,
If
Madam Chair.
everybody understands. So when we raise the provider tax, we have to, or when we have the provider tax, we are always paying that extra 2% for those providers. Representative Zerwas, is that confusing?
Well, I'm just,
Yeah.
so the hospitals don't pay it, they pass it on to us.
Well, right, well, whoever's paying the MA providers, yes, they are not, when they charge MA, they pay the 2% and we pay for it,
Well, we-
essentially, right?
Pass it on to the end user.
Yeah, maybe.
Madam
Berg?
Chair.
Madam Chair, Representative Zerwas, in this case, the idea is that for public programs, the state pays the cost of the tax in the charges for the public program, so the providers are not actually being taxed.
Okay.
Or they are being taxed, but it's being paid back.
And
By
Yeah.
us. They're
By the
being taxed.
state, by the state, yes.
They're being taxed and we're paying it.
Madam Chair.
Yes, and it is being paid
Yeah. Yes.
in
I
our
mean,
budget, yes.
Yeah, so in a private insurance situation, when they're being taxed, the end user, the payer, pays it.
Madam Chair,
Representative Halverson.
I can shed some light on this for Representative Zerwas. When Minnesota Care was created and we created a funding source to pay for our healthcare system in Minnesota, part of the provider tax, part of the goal with the provider taxes was that it could be folded right into rates. It's not charged on a different line item, and that providers can fold it right into their rates so that they can pass it through. So that it wasn't, the goal was that it was always supposed to be a pass-through. And so the insurers pay it, and the state as an insurer pays it, ultimately. And that was the point, so that it wasn't a burden on the providers.
Thank you, Representative Halverson. I think we can keep going.
All right, Madam Chair, members, on line 943 is the impact to Minnesota Care of the extension of the premium security plan or reinsurance. There is an extension of reinsurance for 2 years. That has an impact on our BHP payments, which will cause the state to pay more for the Minnesota Care program, and that's what this reflects. On line 947 is the cost of the Blue Ribbon Commission that will look for the savings in the tails. On line 952 is the actual savings from the assumed by the Blue Ribbon Commission. Again, that is the backstop on that to make sure that there is actually $100 million in savings or funds is the general fund budget reserve. On line 960 is the modernizing payments for safety net providers. This involves the new payment methodology for FQHCs. On line 968 is another integrity item related to oversight improvement in adult daycare. On line 20, page 28, on line 993 is another integrity piece. Actually, there's several in a row here. The SERS and CCAP investigation expansion item, followed by additional background study federal compliance. Line 1005 is the department's, the governor's system service delivery transformation item. This has to do with IT costs at the department. Moving on to page 29 on line 1014, it is sweeping a balance out of an account that the department has that has got an excess in it, the long-term care options account. Moving to the bottom of page 30 is another program integrity piece related to CCAP, the strengthening oversight of CCAP, which is part of the governor's budget in which the House carried. On the very last line of page 31 is the governor's fraud prevention and investigations expansion item. It's part of the governor's budget and was carried by both out of Representative Pinto's bill and into the House main bill. And that concludes the Department of Human Services. At the Department of Health, the first item is on page 33, line 1147. This is the public health laboratory equipment item. Line 1166 is the governor's plan for comprehensive suicide prevention program. It is the same program, it just ramps up a little bit, so there's a little bit less funding in the first biennium, but it gets to the same level. On page 34 is at the top, line 1181 is the House's Skin Lightening Cream Education Grants item. On line 1185 is the governor's budget item, was carried by all parties for the statewide tobacco cessation quit line. On page, line 1197 is the prescription drug price transparency line. On line 1209 is the health department's portion of the Safe Harbor for Sexually Exploited Youth program. Going to the bottom of page 35 is the portion of the House's domestic violence prevention grants item. On page 36 at the top, on line 1253, is an item that blends both the governor's item that's zeroed out above it on provider network adequacy reviews, and then Representative Liebling's item that's just below it, zeroed out, a managed care network access. The one on line 1253 blends those two initiatives and pays for it out of the state government special revenue fund. On line 1264 is the resources for the health access survey the department conducts. 1268 is the governor's item to repeal an unnecessary infection control law. That's a savings item. On line 1272 is the governor's funding for the medical cannabis program. And then on line 1276 is Representative Edelson's bill that changes the regulation in the cannabis program. On page 37 is on line 1299 is the wells and boring regulation changes. These are all state government special revenue fund items now. On line 1303 is the low-dose ionizing radiation security screening item. On line 1308 is the safe drinking water fees that the commissioner mentioned. On line 1317 is the department's operating adjustment. On page 38, line 1334 is the Community Solutions for Healthy Development Grants Program. This was the governor's initiative. The governor had it in one time for $2 million. The compromise here funds it at $1 million a year for 4 years, and if you read the rider on it, the base stops after the 4th year, and there's intended to be an evaluation of the program to see how effective it is. Going on to page 39, well, Madam Chair, I'll skip over. These are the health licensing boards. I will just point out that the bill funds the health licensing boards at the governor's level for everything except the Board of Pharmacy, where it has the prescription drug repository program bill that was in the House is funded, and there is not the opioid fees, but otherwise it's substantially the same. And the rest of them are funded at the governor's level down through page 41, line 1454, where the general fund boards start. On line 1456 is the Emergency Medical Services Regulatory Board. It's funded at the governor's level. Line 1462, the Council on Disability is funded at the governor's level. 1467, the Ombudsman for Mental Health and Developmental Disabilities is funded at the governor's level. Line 1472, the Ombudsperson for Families is also funded at the governor's level. On line 1478 is a general fund appropriation to the MNsure Board to cover the loss of revenue that they will see because of reinsurance. And so this is supporting their operating costs due to the loss of withhold dollars. Then moving on to page 42, there's some of the more of the sort of large financing items. On line 1506, there is a statutory transfer, annual transfer from the Healthcare Access Fund to the general fund that was instituted in, I believe, originally in 2005, that transfers up to $122 million a year. Previously, with the expiration of the healthcare access, the provider tax, there was no transfer in years 22 and 23 because there wouldn't have been any money there. With the extension of the provider tax, which I should have mentioned, probably most people have heard, but it's at 1.8% rather than the 2%. The fund will have money, and so then those transfers to the general fund happen. So that's another, substantial part of the financing package here. And on line 1514, there's language that stops the transfer of $50 million from the Healthcare Access Fund to the general fund that is related to the chronic disease spending report. This intercepts the money and keeps it in the general fund. On page 43, on line 1519, there is the governor carried in as part of the large budget deal a transfer from the excess in the premium security account to the general fund of $142 million. And then on line 1531, the Senate had an item at MMB that is funding evaluation activities. This is the group that people often know as Results First. And then at the Department of Commerce, on the last page, on line 1568, is the the non-public program cost of the pediatric autoimmune coverage. Because this is a mandate under the ACA, the state has to defray costs in the commercial and QHP commercial market. You see on line 1569 the administrative costs at the Department of Commerce. And on line 1570, I'll just note that those lines are bracketed. That's actually the defrayment cost. They're bracketed because that is an open appropriation, and so the numbers are not directly appropriated by this sheet, but there is an open appropriation in Commerce to pay those costs for pandas. And Madam Chair, that is the very brief picture.
Okay, the very brief picture. I know in this bill, very brief is pretty long. So I just want to really add my thanks. And, I know we always thank the staff, but this has really been nobody should ever have to work this hard. No. And if I have an opportunity to do this again, we're not going to work this hard. I promise you that, because really, to working all night long and negotiating all night long and, kind of under this kind of pressure of time, it's just not good for us. And we are a health committee, we are the place this should not happen. So, but I so appreciate the staff, all of the staff. I don't know, Mr. McCall and Mr. McQuillan have, I don't know how many hours they went without sleep. And probably all the staff too. I didn't ask everybody, like how long they stayed up. I think probably Mr. Berg probably has the record. I don't know. But nobody should have to do that. None of us work very well when we don't get certain minimum amount of sleep. But the professionalism, the hard work, the dedication of our staff and the staff from the agencies and our commissioners and the members, I don't know if Minnesotans understand the great deal that they get here. Politicians get a bad rap. They think we're sitting around, enjoying some kind of big privileges. People here work damn hard, and they don't do it for a lot of money. They do it because they're dedicated to the cause of having a great state. And I think that a lot of the reason that we have the state we have is because of those folks. So, thank you all. I hope that, I know there's a lot more to know and understand about the bill. I don't know when it's going to come up on the floor. I think you'll have some more opportunity to read it, to think about it. We can talk about it. I'm sure there are still things in this bill that I don't understand. There may be things that I'm not even sure are there, so we're all going to, it's just that size of a bill, and a lot of members worked on this. So this is not a bill that any one member can negotiate or write or do by themselves. You know, there's a lot of great product in here. You know, really, and every member of this committee, whether you have an actual provision in the bill or not, and many, many do, you have all contributed to this bill in a lot of great ways, and I could name some names here too, and I probably should, like, I don't know if I was out of the room for a few minutes and the swing beds bill is in here. Representative Schumacher negotiated that. I did not do it. He did it. And, you know, he deserves the credit for that, and it's a negotiated solution, and I think it will, you know, Senator Benson wants them to not come back for 10 years. I don't know if it's going to accomplish that, but she wants to be out of the legislature when they come back the next time. We'll see. And Representative Zerwas, I know, had very important pieces. Representative Baker worked on pieces. Everybody contributed to this bill. So I really, really appreciate that, and I hope that we'll all get some rest in coming days, but we have still a lot of work to do on the floor.
Madam Chair.
Yeah.
I just have to
Representative
correct two of your statements. One, you said that we would never work this hard again. I guarantee you you're going to work that hard again.
Yeah, I know.
It's just not going to have to be for 48 straight hours.
Yes. Indeed.
And so I wanted to make sure that, because I've seen you work and I know how hard you work. And the other thing was, you said that I already lost it because I'm still tired from that, but you said something about we're not going to, oh, no, I can't remember. It was, you said that there might be things in here you don't know. I've walked through the spreadsheet with you probably a dozen times. I would be shocked if there's something in here you don't know. So don't undersell that either, because
no.
because it's just in a tired brain, that's all. I have no doubt that you know what's in here.
I
Madam
have
Chair,
learned.
I don't think the public
Representative Schultz.
knows when we say sleep deprivation, what we experienced, but
Yeah.
I've experienced some tough things like fire ops training, which I'll never do again, which is tough. But this was sleep deprivation where they put astronauts through, right? And see if they can still process things. But we started Tuesday and we finished the bill Thursday night. And we weren't all there, but, you know, Tina and I were there most of the time, and many staff members here were there for TA assistance and other help. Even Commerce was there, MDH, DHS, and staying up. We really got to know each other pretty well, but, and we are in different areas of this SOB and the Capitol, but I never want to do that again. It's not that we're not going to work hard. We just want to have some sleep so we can work hard and process things and make good decisions. But, and then, you know, the rest of the team came in, thankfully, and helped us close it, because at that point, we kind of hit the wall on Thursday night, but I just want to thank Chair Liebling for all the work she's put in all session, off session, and making a really good, I personally think this is a really good bill, and I've been here for 5 years, and the bill is so big because we haven't done as much as we could have in the last 4 years, so that's why it's so large. So people keep complaining about it, but we have a lot to do in HHS, and so, because it's not just human services, it's health, it's Department of Health, it's public health, it's a lot of things for the state of Minnesota. So thank you, Chair Liebling. I hope this doesn't discourage you from staying on this committee, because we have still a lot of work to do. But again, we should never, ever, ever have to go through that sleep deprivation for that many days. And I really want to thank the staff and Chris McCall and Pat McQuillan, who must have been more than like 90 or 100 hours where they got very little sleep. And they've done a lot of work on it, and we went through a lot of spreadsheets and negotiated to try to keep as much in as possible. And I hope that we can get bipartisan support when this bill comes to the floor soon.
And I do want to say, I also want to thank Ms. Niedernhofer, who also, and the Pages, who did an enormous amount of work to keep this committee running and keep the conference committee running, and all of that. Really, the whole thing was quite heroic, but, you know, especially our House research folks, who often work kind of out behind the scenes, and we don't see how much they do, but every word in here has to be written and checked and rechecked and all of that. And before I want to call on Representative Loeffler, but go ahead, Representative Loeffler.
Well, thank you, Madam Chair. And one group that I don't even know if they even listen to us, but also has sleepless nights, is the revisers who, after all of the people that you've just named, have finally completed their work, have to then look through it with a fine, legally trained set of eyes to try and make sure that it all fits in the statute books and stuff. And we hardly ever get to know them, but their work is really important. But I wanted to say that for those of us who didn't have to go through sleep deprivation over the last 5 or 6 days on this bill, and who've had a chance to look at it with fresh eyes, it's really impressive what you all did and what you sacrificed to get here, and thank you very much.
Thank you. And I just wanted to close by saying, we're talking about what a good bill is, and, all of us share the goal of doing the best possible job for the people of this state, having a state where everybody gets the health care they need, where everybody can reach their full potential. And at the end of the day, that's what this is all about and what makes it incredibly worthwhile, right? Because you can really do good stuff. By the same way you can incredibly screw things up if you're sloppy, you can also do incredibly important things for people that they will never know why that is happening. And we have such possibility in the work that we do here. And that is really what makes it worthwhile, right? So with that, thank you so much, everybody. I will see you, most of you, on the floor. We are adjourned.